You're talking a lot about inflammation. Well, let's just start at the very basic level. There's acute inflammation, immediate, right now, and then there's chronic, smoldering, low-grade, relentless. When I say inflammation, I'll be referring to that type. Now, acute inflammation we think is adaptive and healthy and it's necessary. You get cut, you get hit, you get bruised, you break something. You better mount a good, robust inflammatory response to make sure that you initiate and perpetuate the healing process. But that goes away. It's short term. What if that didn't go away and somehow just kept smoldering? When you put out a house fire, for example, you're going to get the big flames, but you dare not leave those embers decimating the infrastructure. And that's what happens all the time with our modern contemporary diseases of civilization. They're all associated with inflammation. Alzheimer's, Parkinson's, arthritis, autoimmune illnesses, most types of depression, MS, autism, whatever. Okay, that's all associated with inflammation. And it's interesting that these inflammatory, modern, contemporary, degenerative diseases of civilization have overtaken infections as the leading cause globally now of death and illness. Well, where does all that come from? And here's what may surprise a lot of you, maybe not, and that would have to do with the gut, right? So we think that dysbiosis and imbalance among your microbial powers that live inside your gastrointestinal tract is driving that whole process. This dysbiosis leads to leaky gut. What is that? Increased intestinal permeability. That's then what allows all these nasty things that you're eating, or all these bugs that normally would pass right through your intestinal tract, get into your system, and that's where 80% of your immune cells reside, and off we go. Any antigen, foreign protein that they don't recognize, they're going to launch this incredible, robust immune reaction, and if you can't settle that down, and then that's how this inflammation gets perpetuated. Now, once your gut leaks, your brain leaks, and that's how then this all gets circulated, and that's how inflammation leads to so many different transdiagnostic symptom domains. Now, a lot of times you're just going to get slapped with a diagnosis of depression and be put on an SSRI, and sometimes it's appropriate, oftentimes it's not. It's you're inflamed, and if I could get you feeling better and lower that, all that other stuff is going to get better and go away. Well, how do you know if you're inflamed? Pain is inflammation. Certainly that's the one we recognize the most. So I'm looking for that triad, that trinity, the Larry Curly Moe of inflammation, which would be brain fog, lethargy, and lack of joy. No energy, no get up and go, no vim, vigor, and vitality. And your brain don't work to boot, right? So you can't make decisions, you're kind of paralyzed, and then you don't want to do anything. And when you do, you don't like it, right? That's that anhedonia, that lack of joy. I can also measure inflammation in your blood, and I do this routinely. What labs are we talking about? You're going to get a CBC, you're going to get a lipid profile, you're going to get a thyroid panel, not just a TSH, you're going to get a fasting insulin, you're going to get a vitamin D level, you're going to get a measure of systemic inflammation, the high sensitivity CRP. At the same time, we'll look at your adrenal function, because that is very, very tied into your level of inflammation. What does your salivary cortisol show me over the course of a day? And I'll bet you by golly, right, Shubabaruni, that yours is, if you're inflamed and have brain fog and lethargy and fatigue, you have low cortisol. My natural approach to this is going to be pretty comprehensive. And if you leave any one component out, you're probably going to have suboptimal results. It's always going to start with healing and sealing your leaky gut. Now, fortunately, the things I use to do that also support your adrenals and right-sized inflammation. What is that? Big into omega-3. It's going to be a lot of fish oil. You're going to get your D3. I'm going to want to see your D levels in your blood in the 60s. Nextly, it's a word, I'm going to support those adrenals with an adrenal-specific vitamin. Then I'm going to go ahead and make sure you're on a good probiotic. I've actually formulated my own 4-Flora. It's my favorite. It's the one I take. I'm going to give you a good NRF2 pathway activator. Think about it this way. We like our antioxidants, anti-inflammatories, vitamin E, vitamin C, and you can take a whole bunch of these. It'd be like throwing a cup of water on a raging house fire. It's not really going to make a difference, and boy, you'd need a lot of cups of water. how can I go upstream and turn on the sprinkler system, right, to really douse this inflammation, this house fire? Well, that's your NRF2 pathway activation. That controls hundreds upon hundreds of genes. You're also going to get L-methylfolate in a lot of it. And then you might get, depending on your symptoms, a little bit of, drum roll, a little bit of organic lithium orotate for neuroprotection. And again, right sizing of inflammation. Like I said, you're going to get a comprehensive approach. Keep in mind that you're 60,000 times more likely, 60,000 times more likely to have a side effect from a medication than a supplement. All right, so these are enormously safe. Certain things get better sooner than other things. I'm looking for early improvement in clarity of thought, in executive functioning, and energy. If I can give you your brain back, then you're going to be better able to attend to the lifestyle changes that you need to make. Well, can I use these natural approaches with my conventional treatments? Absolutely, I do it all the time. That's kind of what I specialize in, integrative approach. And I always want to know what you're getting from your other clinicians and your prescribers. I need to know that. And my goal would be to make those work better, fewer side effects, maybe eventually get you off some of that stuff. Okay, we really want to help if we can. You've done your homework, are you kidding me? And you know what's out there, you know what rings true. We want to not only help you build and maintain health, we want you to more effectively pursue happiness, however you define that, and we'd even like you to live a little bit longer, certainly be healthier longer. Those are important goals, and we share them with you. So give us a call, for crying in a bucket.